Doctors diagnose Parkinson's based on the signs and symptoms that the person may present with. Sometimes these symptoms can be quite obvious, like tremor or shuffling gait. Others can present with quite a challenge. People, often younger people, present with frozen shoulder or pain in their hand or pain down their leg. The doctor will ask many questions focusing on the examination of the nervous system. Unfortunately, to date, no laboratory test has been devised to diagnose Parkinson's. A brain scan might be done just to rule out other conditions. An MRI scan is usually performed as well. A wide range of professionals can help people with PD. These can include specialist doctors and nurses, family physicians, physical therapists, community nurses, pharmacists, dietitians, social workers and speech therapists. Unfortunately, there is no cure for PD at present. However, there are a number of ways to treat it. The treatment available can be very effective in controlling the symptoms of PD. Medications are the most commonly used treatments, alongside physiotherapy, exercising and a good diet. Surgery can be used as PD advances to help control the symptoms, especially motor complications that can occur. The medications prescribed for PD usually work by either replacing the dopamine that has been lost or working like dopamine to help the brain produce normal movements. Replenishing dopamine levels is usually achieved with a drug called levodopa. Levodopa is converted into dopamine, which increases the natural levels of dopamine. Today's levodopa treatment are enhanced with additional drugs that prevent the breakdown of levodopa, therefore getting more to the brain. Dopamine levels can also be increased by medications called monoamine oxidase B inhibitors, which prevent dopamine from being broken down in the brain. The second approach is the use of drugs that mimic the action of dopamine. These drugs are called dopamine agonists. These agents activate the dopamine receptors on target cells in a manner comparable to dopamine itself. As a result, the message that dopamine usually carries is passed on, in effect, tricking the brain into thinking it's getting dopamine. Levodopa is a gold standard therapy for Parkinson's disease. Almost all patients with Parkinson's will require treatment with levodopa. Over time, and as Parkinson's progresses, the effect of levodopa can fade away. In other words, can wear off between doses. The person will describe the symptoms re-emerging before their next tablet is due. Other side effects that can occur is involuntary movements called dyskinesia. These can develop when the medications reach the peak in somebody's system or as they fade away. More specifically, wearing off is when the effect of levodopa fades away, before the next dose of levodopa is due, and the person with PD experiences a return of his or her PD symptoms that lasts until the next dose of levodopa is taken and begins to work. This is one reason why it is important that people with PD take their medications at prescribed times, on time, every time. PD specialists and doctors often use special terms that the person may not necessarily understand. For instance, on, off and freezing. On is when the person's medications are working well, and off is when the medications aren't working so well. Freezing episodes relate to when the person is walking and they suddenly get stuck, their feet are frozen to the floor.